One thing that we have to think about in people with intellectual and developmental disabilities is about their skin and their skin health. Sometimes they're not aware that they may be developing an abrasion from, say, some sort of assistive device like an ankle-foot orthotic, or a part of, if they use a wheelchair for mobility, maybe there's a part that's rubbing on their skin, or sometimes they're not able to move as much and they're at increased risk for skin breakdown. And there are some medications that can increase that risk. And that's what we're going to talk about in the next couple of minutes. So some types of antibiotics can actually impair wound healing. Blood thinners can impair wound healing. Some of the drugs, if people are on medications to treat cancer or different types of cancer regimens, that can increase their risk of problems or skin problems. Sometimes some types of anti-rheumatoid drugs for people who might have rheumatoid arthritis. Anything that suppresses the immune system can make skin healing worse. Some of the non-steroidal anti-inflammatories, these are things like ibuprofen and all, those types of drugs sometimes can impair wound healing. Any type of steroid, including the topical corticosteroids, things like hydrocortisone cream, stuff like that. Those are mild, but some of the stronger ones can actually impair wound healing or weaken or thin the skin as well. Even stuff like nicotine that people who smoke, because it constricts blood vessels and reduces blood flow. So keep in mind that some medications can actually impair wound healing. There are some medications that can help with wound healing as well. Things like vitamin A, vitamin C, zinc. So you may see people who have some type of skin issue that they're placed on these medications. Now, there's another category to think about as well too. So we're at risk for a skin breakdown when we lay in the same spot for long periods of time, because pressure reduces the oxygen flow to those areas. And anything that sedates a person, that makes them sleepy, that makes them less likely to roll over, to move, to turn, those types of things can put you at increased risk for healing issues as well too. Things like some of the seizure medicines can be sedating, some of the narcotic type medications, some of the medicines that are used to keep people from throwing up, we call them antiemetics, some things for anxiety, skeletal muscle relaxant type things, muscle relaxers. So anything that can cause sedation can also increase the risk, especially if a person is on long term. So think about it and contact a pharmacist if you're having concerns or issues about these things to learn more about it.